Thank you, Mr. Speaker. I'm pleased to come to the floor today to speak in support of the Restoring Access to Medication and Modernization Health Savings Account Act of 2018. This legislation makes a variety of simple but much needed changes to health savings accounts, or HSA rules, to ensure that folks have more access and choice when using their HSAs. This bill contains 5 separate bipartisan pieces of legislation that passed the Ways and Means Committee earlier this month. It includes a bipartisan policy by Mr. Roscom and Mr. Thompson that would allow HSA-eligible plans to offer a certain amount of first dollar coverage in their plan design without losing their HSA eligibility. This allows HSA plans to offer coverage for valuable services like telehealth or primary care appointments without a deductible. The bill permits patients with HSAs to access the innovative and patient-centered direct primary care arrangements with HSA plans, provision championed by the bipartisan team of Mr. Paulson and Mr. Blumenauer. The bill also allows coverage for certain medical services from a retail or on-site clinic and permits contributions to an HSA if their spouse has a health FSA, which is prohibited today. Another common sense provision in the bill allows rollovers from other tax-advantaged health accounts to be used to fund HSAs. These proposals were included in Mr. Kelly and Mr. Blumenauer's bipartisan legislation. Additionally, this bill contains the FIT Act, introduced in a bipartisan manner by Mr. Jason Smith and Mr. Kind, that would allow certain qualified fitness expenses to be eligible items that can be paid for with tax-advantaged dollars, offsetting a portion of their cost and promoting healthy activity. Lastly, the legislation repeals the Affordable Care Act's unnecessary barriers when it comes to using tax-advantaged health accounts to purchase over-the-counter medicines, something that I've been pleased to work on with my good friend Congressman Kind for the last several years, and I'm encouraged that the bipartisan duo of Representatives Meng and Paulson have also joined us in introducing the underlying legislation. In addition to expanding access for over-the-counter medication, the bill also allows for feminine hygiene products to be considered a qualified medical expense. Since the passage of the Affordable Care Act, Americans have had to seek prescriptions in order to use their health savings and flexible spending accounts on safe and effective over-the-counter medicines. This legislation would end the need for those prescriptions. It doesn't make any sense to require the millions of American families that use HSAs and FSAs to manage their health care needs to go to the doctor in order to access over-the-counter medicines for things like basic pain management and cold and allergy symptoms. Nobody benefits from this nonsensical policy that requires consumers to jump through unnecessary hoops and increases the burden on the healthcare system, all while providing no medical benefit. Over-the-counter medicines are often the frontline treatment for many common illnesses and for maintenance of chronic diseases, and they should be treated as medically reimbursable healthcare therapies, just as prescription medications. Mr. Speaker, I'm pleased the House is considering H.R. 6199, which gives individuals and families more control over their health care spending and increases their options when it comes to health savings accounts. Today marks a nice opportunity to pass bipartisan legislation to simply make it easier for consumers to meet their basic medical needs. These are common sense, simple, bipartisan solutions, and I urge my colleagues to support this legislation. Thank you, and I reserve the balance of my time.